everyone to the third module of Science Policy and Advocacy for STEM Scientists course.
So Dr. Wendy Ingram is a mental health medical informatics researcher at Geisinger Health in Danville, Pennsylvania, in the Psychiatry and Anesthesiology Department. Her research entails using electronic health records and genomics to better understand mental illnesses, their treatments, and outcomes. During her time as a graduate student at UC Berkeley and a postdoc at Hopkins, she worked with students, faculty, and administrators to develop depression awareness and anti-stigma programming specifically for academics. So Wendy is now the co-founder and executive director of Dragonfly Mental Health, a nonprofit dedicated to cultivating excellent mental health among academics worldwide. And Dragonfly operates through conducting independent research, developing and deploying programs to institutions, and fighting for broader systemic change. Wendy?
Adriana, and thank you. It's wonderful to be here amongst these incredible other speakers. So we are called Dragonfly Mental Health, and we are very newly formed as of officially April. We are a nonprofit corporation in California, and so that's where I'm at. I got to come back to California, the home of where I did my PhD at UC Berkeley, where I studied very different things. I was studying a brain parasite that causes mice to lose their innate fear of cats. So never fear from making some big changes in scientific topics or career changes, or at least that's my trajectory that's happened over the years. So as Adriana mentioned, I'm the co-founder and executive director of this nonprofit. You can reach us at academicmentalhealth@gmail.com, visit us at dragonflymentalhealth.com, or at us at dragonflymh on Twitter. So please do reach out and get in touch. So my focus on mental health in academia starts really because I've been personally dramatically affected by academia not being prepared to take care of learners and faculty. So when I was in graduate school, my fourth year, one of my classmates and colleagues and good friends died by suicide due to depression. And so one of the things that we also noted that same year was that there was a suicide at every level just within our department that same year in 2013. So there was a faculty member, a postdoc, and an undergrad, all in the molecular and cell biology departments, that all died by suicide due to various forms of mental illness that were underlying and under-addressed. And so this isn't just to underscore how big of a problem this is among academia in particular. I wanted to share a couple of data points, which it's so important to have data, and unfortunately we have so little about it amongst our learners and academic career folks in biomedical sciences and academia in general. But graduate students have been found to have 8 times higher rates of severe depression and anxiety than non-academic graduate students of the same age. Those with higher IQ have been found to report higher rates of mood disorders, but are less likely to seek treatment for them. In addition, you know, I started off talking about suicide, but now I'm talking about mental health and mood disorders because we know that 80 to 90% of all suicides are due to an underlying undertreated mood disorder. And so one thing I want to bring up just to emphasize, build off of what Bandu really emphasized more eloquently than I could, and in a slightly different way, the personal experience. Academia is an incredibly high pressure place to be. To choose to get a PhD is something that inherently is going to have extreme stresses, financial stresses, personal stresses. And in addition to all of that shared experience, there's a lot of diversity of personal experience that can affect people's lives and thereby their mental health as well. And so some of the things that women I know have experienced have been told, you're too pretty to be a scientist, or much more horribly experiencing sexual harassment, even by PIs or colleagues. First generation students often have a lot of economic challenges, and people will take advantage of people. There are burdens and barriers that are put in place that people who don't have independent wealth, that don't have family members that can help support them, can't start work for free, can't defer reimbursements for travel to meetings and things like that, and are often chastised that you should have thought about money before pursuing education, which is unfair and not helpful. A lot of people of color are friends of mine have been assumed to be janitorial staff, or when I was at Hopkins, were stopped and questioned by police and security, whereas myself and other white individuals don't experience that kind of harassment. International students, as was indicated by previous data shown, a lot of postdocs are international, a lot more students are becoming international, and there are a lot of cultural differences and language barriers. And so friends of mine have said that being criticized or overly praised for their English or their accents are a form of harassment, a form of stress that they're experiencing. And there can be cultural communication differences with managers, or even with mental health in particular, being able to connect with the mental health professionals that you can get connected with. And then folks that are LGBTQ+, often experience marginalization and homophobia. One of my very good friends was regularly told that their genderqueer clothing was unprofessional, whereas I can assure you I was wearing much less professional wear than they were. And they often expressed to me that they felt unsafe walking alone and working late nights, whereas even I felt fine doing that. So another point is that, these identities don't belong separately from one another. When people belong to more than one of these groups, the risks combine, and often more than just additive effects. So I did want to take a little bit of my time to emphasize these points, and that, policies affecting focusing on gender, policies focusing on underrepresented minorities, policies focusing on pipeline retention, on elevating people's experiences are so important. And I'm pleased that my focusing on mental health actually does allow me to connect with folks that are brilliant and wonderful and massively effective advocates across all these groups, these identities, these things that we need to know and think about. So a comparison I like to make is between elite athletes and academics. And we know that the best athletes in the world train incredibly hard. They give their all to achieve peak performance in their field. But whenever there's an injury, even the smallest one, a rolled ankle, the response is to address it immediately, even courtside, for all the world to see. And, we are privileged to be able to train our minds at the highest level as scientists and researchers. And yet, unfortunately, when our minds, the most critical instrument for our work, becomes injured or strained in some way, our instincts tend to be just keep doing what we're doing. And so, unfortunately, some studies have even shown that people who don't seek help right away, on average, wait 6 to 8 years before seeking help for mental stress, mental distress, mental illness. So this is a major issue. And it's something that is cultural in academia, unfortunately. The fortunate and good news is that mental illness is highly treatable. Depression, anxiety, eating disorders, substance use disorders, OCD, and autism spectrum disorders are all incredibly well, are treatable. What we've also found is that awareness, early identification, and early treatment are really key to getting people to a place where they can continue on in the pipeline, in academia, in their chosen career choices. So what really is unfortunate is, in particular, but similar to many other illnesses, is that mental illness, when left untreated, really leads to other comorbidities and issues with disorders getting worse, which can complicate and recover and delay treatment response, even when people do seek treatment later. So ultimately, we really have to emphasize that community support and encouragement is hugely impactful for seeking care and sustaining treatment engagement. And getting people back to where they need to be in order to be doing what they love in the academic setting. So things have changed a lot, or maybe not a lot, but some at least in the last decade. When I was starting graduate school, we didn't speak much, if anything, about mental health, let alone mental illness. Now most universities actually do have wellness programs, but what's unfortunate is that they're less effective, and they're often not even targeted towards graduate students, postdocs, and faculty. So that's a gap. And then in particular, and what I've found is that cultural and systemic barriers really are driving graduate students and faculty to seek support less often. And one of the phrases I think a lot of people are familiar with, unfortunately, is the phrase publish or perish. And I stand firmly that that should not be literal, despite the fact that we do have extreme, unique pressures. I think the culture needs to change quite a bit for the betterment of all. And so what Dragonfly Mental Health's approach is threefold, and really operating in a lot of ways that what other folks have said and mentioned is, so we have a research component that's volunteer driven. The Global Consortium for Academic Mental Health is aimed at improving our knowledge and addressing systemic issues. We have an on-campus program where we're leveraging grassroots type efforts to create cultural and climate changes directly within an academic community. And we're also focusing on a global level and self-starter kind of level of bringing people around the world from all different disciplines within academia to network with each other and talk about mental health more openly. And so that's something that platform we're calling Dragonfly Cafe. And we have both live events and an online Slack space for people to network. So one of the things that we're also doing is focusing on working with universities over time. And so we have identified 5 domains of excellence that we think that universities and departments really need to assess and then engage within in a sustainable, long-term focused way. And so one of the things we also acknowledge is that while there are universal principles that many people can experience and benefit from, evidence-based approaches that we're developing and working on and trying to disseminate, there's also going to be some customization for each community. So physics may be different from humanities. The medicine folks are going to require slightly different approaches than mathematics. So we acknowledge that, and we're building a system with which we can provide each academic community its unique needs. So we are a phenomenally wonderful volunteer-driven community. Right now, we started recently, but we've really made a tremendous amount of progress in a very short period of time. So we have over 85 volunteers from 15 different countries. They're currently studying at 25 different universities in over 22 different discrete disciplines. So we would love to have anyone who's interested get in touch, check out what we're up to, and get involved. So you can join us at Dragonfly Cafe, volunteer with us if you like, or just inquire as to what that might look like, and or bring us to your campus. So we offer existing programming right now available today.